Thank you very much. Um, so in this session, as you all heard, we are going to talk about the intersection between climate change and health in particular. And I'd like to start with Vanshika. Vanshika, would you like to give us a background on how, for the last many, many decades, there was a bit of a hesitation to bring in health and climate, to look at health from a climate change perspective and vice versa, and how this has changed in the last decade?
Sure. So, firstly, a very good afternoon to everyone. So when you think of the climate conversation, traditionally the focus areas and the sectors have been energy, industries, mobility. The human and social development sectors have been kind of the laggard areas. And it's interesting to know that, because if you think of health, health is literally at the heart of climate change. And climate and health are, as now increasingly recognized, twin emergencies and two sides of the same coin. But it's taken many years, and only in the past, I would say 3 to 5 years, that there has been concerted, collaborative of effort globally to look at this intersection, and there are multiple reasons for that. Of course, in the last decade to 2 decades, the impact of climate change on human health and planetary health has become much more visible and tangible. So that is of course one. Second, that of course sustainable development has become, through a lot of the agenda setting and the frameworks and mandates, has become intrinsic to multilateral efforts, and even at the national and local level, there's much more focus on climate change. You have institutions which are increasingly becoming climate first, and budgetary allocation towards climate and its intersections have emerged. Along with that, I would just like to pause and also say that while climatic impact on health has received more attention, but it's not just a one-way equation. When we look at the intersection, we also need to look at healthcare's contribution to climate change. Because it is also a high polluting industry which hasn't been looked at till now. Just to share some data points, on the climate to health side, in the last 30 years, almost 5.6 billion human lives have been lost, and about 1.5 trillion has been the economic loss on the front. And from the health to climate side, an area which has been completely overlooked, and now the realization is that while it's traditionally seen as a do no harm sector, but it's also contributing because health facilities are running 24/7. So we do need to think of low carbon, resilient, sustainable health systems as well, and what does it mean across the chain, from at the health facility level to supply chains and so on, to of course leadership and governance as well. So on that side, we see that if the health sector were a country, it would be the 5th most polluting, and its GHG footprint is almost 5.2%. And
is this a global statistic?
This is a global statistic, and all this evidence has come up only in the past 3 to 5 years. So now there's much more momentum, and I can say that very happy to share that actually there's in the first time in human history that there has been this convergent effort. It started institutionally. I would say the starting point was in 2021 when COP26 at Glasgow had the first kind of formalized programming around health, which was a half-day focus, to COP28, where there was a dedicated health day, one for the first time in 28 years of UNFCCC. And as much as we know the challenges and with a lot of these convenings, but health has actually come up in a big way, and it led to the Climate and Health Declaration, where 120 countries for the first time have committed towards low carbon, but most importantly, first, resilient health systems and low carbon healthcare as well. And just to add that along with this, even at the G7 and G20 level, in Germany and during India's presidency, there has been commitment in the formal declarations as well. So I just wanted to lay that landscape, that a lot has happened, and happy to throw light further.
Thanks, Vanshika. Jay, I'll come to you. You wrote a book on this very intersection, between climate change and global health in 2017, and your book was called Enviromedics. So if you could tell us a bit about what you were thinking of in 2017 and how things have changed in the intervening years.
I think, oh, thank you, Vanshika, you covered it well, what happened at COP 28, 29. I think the big changes are that health is now a player, at least at the COP level. We're seeing more and more organizations coming in and thinking about how to decarbonize, and it really motivates the health sector. So I think of the WHO Attach group, the Healthcare Without Harm, where now there's, again, sustained effort in making health one of the top global priorities for climate change. When we wrote Enviromedics, we wanted to write an inventory of climate and health effects from the physician's voice. So I wrote it with my now deceased co-author, and we wanted to bring the reader to the bedside, and I'm an emergency physician by training, and really bring a visceral sense of what the consequences are. So here's what it's like to have to intubate an 11-year-old girl who can't breathe because the smog and the heat is so bad that her inhalers no longer work. So again, these are composite patients, but again, a very visceral thing where we could share that, because we knew that we were losing the battle for hearts and minds when we were using comparisons with public health. So the big things: heat, water insecurity, food insecurity, vector-borne disease, that's mosquitoes and ticks going in places where they could never thrive before, climate dysphoria, mental health displacement. That was the inventory, and we put it out there. Since then, I'm sad to say most of our projections, which were just a synthesis of the data at the time, have proved to be the more modest projections at the time. Real data has outpaced it, unfortunately. And I guess to your last question is what would we have done differently? I wish we had used more deliberate voice and be less equivocal. I think we're trying to kind of get people to jump in. Remember, this is 2017, and certainly we were thinking about climate skeptics probably a little bit too much. So as you had suggested, it's time for an update of,
Absolutely.
of the book.
So much
time
has
to get
happened.
writing.
Yes, a new and updated Enviromedics. Pranay, let me come to you. In your book, Invisible Empire, you've talked about viruses, and you've drawn a very close relationship between viruses and climate. So would you like to say a bit about that?
Thank you so much. In my book, I talk about the unimaginable link between viruses, the microbial world, and the global carbon cycle. In fact, it's not just carbon cycle. Every mineral cycle depends on the microbial world. We have a penchant to actually think that trees are going to solve all our problems. I think we've crossed that line. Just bear with me for a minute and I'll tell you why I don't agree with most interventions that are talking about rewilding, afforestation, reforestation. Now, trees are very good at capturing carbon and releasing oxygen. But the problem is this, that they are extremely selfish when it comes to releasing oxygen, because they're going to absorb it the next day. And the carbon accrual is very slow. We need to now accelerate the process of carbon capture. And the same thing needs to be done in terms of sulfur cycle, potassium cycle, phosphorus cycle. All of these are broken. All of these are interlinked, and all of these need to be brought together. How do we do this? We are currently fixated just on the carbon cycle. Okay, nobody's talking about nitrogen. Nobody's talking about other mineral cycles. That's the first point. The second thing that you need to look at is each ecosystem, each landscape has its unique minerals and unique microbial systems. And that's what does carbon capture on a daily basis at a grand scale. And this understanding is something that has not kind of come across, whether you look at the IPCC, for example, if you look at the, I'm sure everybody knows what the IPCC is. It's the commission that looks at, the whole climate commission, the panel that decides on, what should be the steps, what are the adaptation measures, what are the mitigation measures that need to be put in place, and where are the targets, how are they being met. The challenge is this, that we don't talk about the ocean cycles till the third report. The importance of ocean and carbon burial at sea is not even considered. Even currently, there are no projects that are in the carbon mitigation space that look at oceans for carbon capture. Oceans bury about 75% of all carbon in the world. It's not trees on land. It's the microbes on the first 80 meters of the oceans that bury carbon. Just one last point before I leave my point rather than hanging it. The reason why viruses are important is because they expedite the cycle of the photosynthetic capture by microbes, and they kill the bacteria in the oceans quickly. So the cycle is, instead of 24 hours or 12 hours, it's faster and faster and goes faster by the season. Unlike plants or trees, which take an entire season to grow and then stay on the surface and release the carbon dioxide back. In oceans, the microbes that capture carbon, they die and sink at the bottom. So the burial is at the same site, and you've got a massive carbon cycle that is taking place on a daily basis, unlike on land. So that's the difference that happens on oceans and lands, and I think this segues into what James is going to add to.
Yes. James, your book, Deep Water, is fascinating. It's a study of the oceans and what happens there. But, it begins at a very appropriate note with Arthur C. Clarke's quote, where he says, "How inappropriate to call this planet Earth when it is clearly ocean." And a part of your work on the oceans is about, ocean heat waves, as well as the ocean current changes, and all of which has a huge impact, not just on human activity and populations, but also what we're trying to talk about, which is essentially health. So would you like to say something about this?
Thank you. And thank you, Pranay, for talking about the role of the oceans in the carbon cycle, which actually doesn't get talked about enough, I think. I mean, the thing with the oceans is when you look at the excess energy that humans have put into the atmosphere by, the extra heat that's been caught because of global heating, 90% of that has gone into the oceans. More than 90% actually has gone into the oceans. And so there's just this vast amount of energy being transmitted into the oceans. In fact, there's a scientist called Dana Nutticelli, and he talks about what he calls a Hiroshima, which is a unit of measurement, which is the amount of energy that was released by the atomic bomb at Hiroshima. And in 2022, the oceans absorbed the equivalent of 5 Hiroshimas every second, of every minute, of every hour, of every day across that year. I mean, that is the scale of the energy that's going into the oceans. And what that has meant is that the oceans are heating up. They're heating up, because the ocean is very big, because water absorbs it can hold lots of energy there. They're kind of slowing that process down for the planet, but they're heating up. And, ocean temperatures over the last couple of years have been completely off the charts. The rate of ocean warming itself is speeding up. There's a study out last week showing that ocean heating has quadrupled. The rate of the increase of ocean heating has quadrupled since 1985. And that energy kind of has to go somewhere. And so what's happening is the water gets warmer. You're seeing increased incidence of dieback of kelp, increased incidence of dieback of seagrass meadows, and really significant amounts of coral bleaching. So coral reefs in particular are being hit very hard. The world's lost half of its coral cover in the last 50 years. There's just been one devastating bleaching event after another. I mean, come from Australia along the Great Barrier Reef. There's just been one after another after another. There was one last year that was just absolutely devastating. There's another one beginning at the moment, it looks like, over on the west coast. And that's really relevant to human health because coral reefs particularly, but all of those ocean environments, kelp, seagrass, all these things are incredibly important sources of nutrition. So several billion people in the world rely upon the oceans for their principal source of protein. But also because it's generating more and more extreme weather. And that extreme weather is driving, higher incidences of floods, of fires, of devastating storms, of drought. The shocking droughts that have occurred across the north of Africa are all climate change related. And those have direct health effects on people, but they also have indirect health effects. Jay was talking about forest fires. I live in Sydney. We had massive bushfires in 2019, and it's kind of difficult to communicate the scale of them to people. But, I lived in Sydney. For 2 months, you couldn't see the sky because there was smoke everywhere. I have a friend who's an anaesthetist at one of our big hospitals, and they were closing the operating rooms day after day because there was smoke in the operating rooms. My kids were not allowed to go outside at lunchtime. And although we managed to keep the number of people who died directly from the fires under control, partly because there had already been very bad fires down in Victoria a few years before, and they'd worked out how to do that. Several thousand people seem to have died from respiratory things over the months following. So there's a really significant kind of bump in deaths from that kind of thing. But also you see these effects being kind of affecting people in a very disproportionate ways. They kind of accelerate social disadvantage. So when you look at the floods and the fires in Australia, if you're an Indigenous Australian, you are twice as likely to be affected by those disasters as you are if you are a non-Indigenous Australian. So you have the most vulnerable, the most socially and economically disadvantaged people in the country being affected twice as much as everybody else. And that just accelerates existing disadvantages, it accelerates existing inequities about health. It accelerates existing inequities around mental health, and a whole range of things. So there's this absolute connection between those things.
I think there's an important point there, which is when we think about this from a medical perspective, climate change is a disease of vulnerability, and it's socioeconomic, it's geographic, it's physiologic. But that is the paradigm. If there's one thing that I personally could have everyone here walk away from, it's understanding that it's the most vulnerable who will get pummeled.
Absolutely. And I think now it's time to address the elephant in the room, which is I would like each of you to respond to the US withdrawal from the Paris Climate Agreement. And you can do it, at an individual level, how it impacts your work, how it impacts the global climate conversation, and what do you see happening in the next few years because of this, as a direct result of this. So, Vanshika, you can start.
So, I think, of course, undoubtedly, the landscape is going to change a lot. But for me personally, since I've been in an institution which is multilateral and has 70 plus member countries, where the way multilateral development banks work is that they're on an equity-based model based on shareholdership. And for instance, at ADB, Japan is the major country, donor country, with about 15.6% rights, which is equivalent to the US. And most of our projects are actually in the global south, across South Asia, Southeast Asia, Pacific, and Africa. So because this institution has that architecture, it is protected from perhaps, of course, I think the more direct impact that's felt in UN agencies vis-a-vis other institutions that get direct funding from the US itself and are dependent on them. Here we have a much more diversified pool of financing. We also increasingly, a lot of MDBs are working with the private sector, philanthropic capital. Of course, while certain set of stakeholders would pause and stop, there are those who feel that all the more we need to intensify our efforts, right? to counter the deficit that we're seeing, the pullback and the withdrawal we're seeing. The second is, as leadership of the US recedes, other countries will step up or will want to fill that position, be it India, be it China, be it other countries. So it'll be interesting to see how that happens. But I can say that for a lot of the multilateral institutions, besides even ADB, AIIB, for instance, which US is not a member of, but has 110 member countries, will have even a much bigger role to play. So it'll be interesting to see how the geopolitical landscape unfolds and how the dynamics change between the existing kind of the anchor institutions in the international development landscape. I must also add that this agenda in particular, the climate health intersection, has now reached such a level of maturity that I think it's here to stay, and it's not something that's going to just evaporate. For instance, a few months back, all the MDBs came out with a joint MDB, a joint investment roadmap. So how do you start identifying for all the problems that have been mentioned for extreme weather events, infectious diseases, water, food, nutrition challenges, mental health, how do we solve for them? So there has been over the past, at least 2 to 3 years, so much work on looking at who are the institutions doing the work, who are the public sector entities, the private sector entities, civil society, what kind of tools and solutions for be it to counter the urban heat island effect. Marine thermal heating was being spoken about at length, and I'm happy to tell you that thanks to so much of evidence that's coming out and so much of literature that's coming out, this is definitely an area the MDBs are addressing as well. So, not just urban pockets where heating is usually looked at traditionally, but also coastal communities and the vulnerable as well. For all the kind of projects that multilateral banks fund, I must share with the audience that the focus on vulnerable communities and environmental and social safeguards is very, very high. And that's what makes the project preparation and execution and design and delivery actually very different from what national governments do. And even when you're in that negotiation period and the project goes for board clearance, the host country has to meet a very high threshold. So we make sure that in whatever partnerships we're working, whatever projects we're designing, the stakeholders are key in terms of the beneficiary group. And to just give a flavor of what are the kind of solutions that we're looking at for climate and health. So for instance, be it urban heat tools, where we can use climate modeling and data science to look at what are the heat pockets, the heat hotspots in cities. In those areas, what is the kind of urban construction material being used, what is the tree, the green cover, and who are the kind of communities living there? Because as was very rightly mentioned, that there is that very unfortunate overlap that a lot of the climate hit or climate challenged areas also have the most vulnerable communities. So how can we use this data for better decision making, better planning by the health authorities, by municipal leaders, and that when we build our cities, we in a greenfield manner, but also whatever brownfield retrofitted measures can take place. So that's one example. We're looking at how we can use environmental data for healthcare. So looking at the number of floods, the kind of wildfires, the kind of droughts. What is the intensity? What is the frequency? How are we mapping it with health challenge, how it's impacting health directly and indirectly, and using that for surveillance and for early warning systems. Along with that, very important that we are developing a lot of accelerator courses for high-level leadership, because finally, this is people in decision-making, and your question also is about that people in decision-making roles, they need to be sensitized. So we're developing a climate and health accelerator, climate health futures course, which will train leadership in developing member countries on the importance of putting climate and health at the top of the agenda, both in terms of funding, also in terms of partnerships, in terms of innovations, in terms of capacity building, and so on. So those are some examples that I thought would help bring a little bit of flavor to it as well.
Jay, you are the only American on this stage. So from that perspective, of course, please react to the withdrawal of the US from the Paris Climate Agreement. But also, what do you think of Vanshika's point that as the US withdraws, it also secedes that space for other countries to take leadership of the climate discourse.
Yeah, I'm a health practitioner and run a climate health program. So there's obviously going to be a big change in global governance. I actually think you're right, and that is that when global governance change, there's going to be new players emerging. I've had the opportunity to be at the last few COPs, and it's a UN conference. It's the Council of Parties, and there's tremendous energy around this. So where the US clearly is going to withdraw, there's no shortage of enthusiasm and energy and ideas. And separating the World Health Organization decision, there's a lot of money that's being pledged for climate and health, as was publicly put forth at the COP28, I believe. And very little of that is tied to the US government. So there's still going to be an influx of funds mobilizing these health ideas. And again, I think the train rolls on and continues, and hoping for the best.
Pranay, would you like to respond?
I was hoping James would go first, but let me. Okay. So I'm sorry, I don't share the optimism that Vanshika has, because, and she's made the right points. I mean, this is what is going to be done, and this is what the investment is for. All that is fine. The reason why I don't share this optimism is this. I mean, I ask you this simple question. I mean, we saw a pandemic happen, in our lifetime, and if you read my book, for example, it says very clearly the WHO and many other leading scientists said that, the age of pandemics is over. That's what it clearly said in so many words. In medical textbooks, it clearly says that with the dawn of antibiotics and vaccines, the age of pandemics is over. Now, let me ask you this question. Would you like to take a guess of how many commissions, national commissions were constituted to find out what went wrong with the national COVID control program? Of the 190 countries, only 11 countries constituted commissions. And that included countries that had less than 1% deaths or whatever, right? Like New Zealand. Most countries, including WHO, has not constituted a commission of what went wrong, okay? And there's so many things that should be evidence-based, and I just gave you an example about climate change, where evidence-based strategies are not used. The same is true for public health. And I can give you examples after examples. What's going to happen with the withdrawal of American funding in global treaties and programs? This morning's Atlantic Review says this, that the CDC is not going to be sharing its data. What was there on its portals is now withdrawn, right? So that's the first thing that happens. Other than the money not coming into institutions, the challenge is that of data. So you don't have an evidence base on which you design programs, right? The second thing that is perhaps going to happen is that we already have a significant share of foundations that have actually started to invest heavily into the WHO and several other places. And there is a clear conflict of interest of how programs are directed, right? That's one thing that I think most people in public health and in the climate space would agree. The second thing, the third point that I want to make, where I think I have a slight point of departure from Jay about the energy part in the COPs, is that there is nothing that teases out the conflicts of interest that exist when negotiations or programs or aid programs and aid instruments are designed. For example, it could be an oil and gas secretary or a delegation that is headed by somebody from the fossil fuel industry that takes charge. Let's look at the previous three chairs of the previous COPs. They were all headed by somebody from the oil and gas sector, right? And you have no clear policy of excluding not just the companies that are causing the problem, but also the NGOs, civil societies who receive grants from them. So that's clearly a no-go because you are actually defeating the purpose of having a fair discussion on climate change or health or any of those intersections that happen. Unless you don't have a carve-out in which we say, we are now going to not let you participate in the policy discussion because this is clearly not a space for you to intervene. I think these three perspectives need to be taken into consideration when you look at the landscape of how treaty negotiations happen. Let's look at two treaties. Pandemic treaty, no progress made. Global plastic treaty, no progress made. We went to our fourth meeting on the global plastic treaty. There has been very little movement globally, whether at the national level or at the global level. There is no clear roadmap of what nations need to do or what a sector needs to do. So I'll stop here. I mean, I'm just making my point that I have a clear point of departure from the optimism that the two previous speakers had.
Just to weigh in on COP, agreed. So COP originally was UN negotiations, and that's a small part of it, but there's 80,000, 50, 60, 70, 80,000 people going. And COP looks like this. It's exactly like this. And who are these other people? They're students, they're youth, they're industry, they're innovators, they're academics, right? They're people trying to make. So I do think that, point conceded, that COP, the negotiation, it is what it is, probably a bit lackluster, but the energy in the seams and surrounding is off the charts and growing every year.
And also to add to Pranay what you were saying, you talked about some very sort of real terms, but also it normalizes climate denialism at a larger level.
I think it denormalizes because I think it's deflecting the whole issue from looking at the real core issues. For example, look at, like I said, oceans don't find a mention till the third report of the IPCC. Why not? Because the most carbon capture happens there. Do you know the geologic landscapes, if you were to look at which is the landscape that does the biggest carbon capture in the world? It's Ganga. Not Yamuna, not Indus, not any river. 22% of the entire geologic carbon capture happens at the Ganga. Rivers don't find a mention till the fourth report. Even today, sediments and carbon burial because of sediments, organic matter burial through sediments is not even considered as a strategy, whether it's by any of these large certifying companies. So, this is the real case in point, that, we are using what the politicians, the corporations, and the public at large wants us to believe, that tree planting will solve the problems. Sorry, we've crossed that point. That should have happened till the 70s, perhaps till the beginning of 80s. I'm not saying please don't plant trees. I'm saying please go ahead and plant trees, but that is not going to be enough in reversing climate change. So that's the denormalization process that we now need to understand based on good evidence.
Would you like to, James, respond to the original question for this round?
Sure. I'll be quick. Look, I mean, I think I would agree with some of what the Vanshica and Jay said about, conceding space, but I'm not sure I concede as a positive thing. I mean, I think what you're seeing with governments, a number of governments around the world, is lots of them actually going to water on their commitments. You're seeing big corporations going to water on their commitments because we're kind of getting to the bit where it's hard. And you now have a government in the US, which, whether it's in or out, is very influential, which is going to provide license to all of those people who want, I mean, as Pranay just said, is going to provide license to anyone who wants to back out. But the thing I would say is that I think one of the things you see with Trump is that there is a kind of constant outrage cycle. And I actually think one of the things that we need to do is to somehow register the kind of endless stream of outrages, but somehow look over them and start asking some questions about why are we here? Like, what's going on? We now have a media landscape that means that none of us have any kind of consensual reality where evidence is kind of gone from the system. How do we bring that back? How do people on our side of the argument provide a more compelling narrative or story for people that we can do that? And that kind of means somehow not getting bogged down in that day-to-day brawl and looking over it and saying, so what are the big questions and how do we deal with them?
You also wanted to actually, James, talk about microplastics and how they're in the ocean and from there they get into our bodies. Would you like to talk about it now?
Sure. I suspect Jay knows more about microplastics and health than me, but I mean, huge amounts of, plastics are a problem for climate in two directions. So the production of plastics accounts for around 3% of global emissions, and then about 11 million tonnes of them end up in the ocean every year. Now, some of those plastics remain whole, so they're bits of nets and things like that, but lots of them break down and they become smaller and smaller fragments. And those fragments, some of them absorb toxins out of the water, some of them just continue to break down. There's now a process we know about on the ocean surface where you see the kind of creation of a kind of mist of kind of what they call nanoplastics, which are unbelievably tiny fragments of plastic. And they are in the atmosphere, they're in the water, they're in the ocean, they're in the breath of dolphins, they're in our bodies. And, they are... We still don't really understand, I'm not going to defer to Jay here, but we still don't really understand what their effects on us are, but they are not good.
They're not good for you.
They are not good. Would you like to talk about... I'm not going to talk about medicine beside a doctor, sorry.
Should we take some questions from the audience now? Are there any mics? Are there any mics for questions?
They're coming.
Okay. Please keep your questions very brief and no comments, please.
The USA has withdrawn not only from Paris Agreement but also from WHO. What do you think this will? How do you think this will impact the UN? You have also mentioned that planting trees will have negligible impact. Do you believe capitalism is to blame for the current environmental crisis? Additionally, what are your views on nuclear energy?
Okay, those are several questions. Shall we take a couple more? This lady in front, please.
Good evening, everyone. My question to the James sir. James sir, how artificial intelligence industry affect the water pollution and shortage of water and effects on the health? Artificial intelligence industries.
Well, I mean, all of the AI data centers and things are absorbing huge amounts of water and huge amounts of power. I don't think we necessarily have great statistics about that yet. It's a bit unclear, but the kind of bump up in US energy use is connected to data centers. We also know that lots of organizations like Microsoft, which had quite tight climate things, have just turned them all off, and that's because they want to chase AI. And it also soaks up huge amounts of water. So I'm not sure that I can connect that directly to health except through the kind of climate crisis. But I mean, clearly there is a whole kind of energy and water dimension to AI that's not talked about, which is part of a much broader materiality about AI. I mean, we think about AI as a kind of technology which is, it's in the cloud, but in fact it's an incredibly physical technology. I mean, it's built out of minerals that are mined often in developing countries under terrible conditions. It is, stuff on social media. You have the content is kind of assessed by people working in places like Ghana who are sitting there watching the videos of like beheadings and child abuse and things like that so that you don't see it. I mean, there is this kind of human and material dimension to AI that we don't talk about enough.
Yes, please.
How do you think climate change is altering the pattern of diseases and the way we live? And what should the startup focus on to address this shift in the both health and the lifestyle?
Startup idea. Yes, Vanshica.
I'd like to address that because, to just give a sense that when we talk about climate and health, there's also the entire ecosystem that's coming up. There's also market creation. There are a lot of these aspects as well. And it's critical to make sure that we identify the best ideas, we're able to support startups, entrepreneurial energy where required. So one major focus area for us is also blended and catalytic finance, where we are working with partners to have innovation pipelines that we plug. So we are very actively looking at that. And I must say that in a lot of our, we held a climate health solutions conclave recently in India. I just want to tie this also to the previous question on leadership, the US and other countries and how things will evolve. I think, strong dynamic leadership in any country should actually see this as an opportunity that, okay, if the US is taking 100 steps back when it comes to climate, if we are doing a lot, how can we drive the world, be it on mitigation or adaptation and resilience, and share those best practices? Just to throw some light, if you look at NHS in England, they have committed that they want to be net zero by 2040, with reaching 80% of those of that commitment by 2028. By 2045, they want to be net zero with supply chains, and this is all out in the public. So if they don't, if they don't meet it, then it shows very poorly on them. So my point is, countries like UK, Australia, Netherlands are doing a lot with mitigation. We have countries like India, Indonesia, Philippines who are looking to do a lot on adaptation and resilience when it comes to climate and health. And therefore, the entrepreneurial landscape and the startups and the kind of initiatives that come up will also will align with mitigation and ANR accordingly. And we need to have more public-private sector engagement, which has also been a focus for a lot of our convenings and agenda setting.
Yes, the lady in brown, please. Yes, you.
Hello.
Sorry.
My question is, China is going to build one of the biggest dam on the Yangtze or Brahmaputra River inside occupied Tibet. And my question is, what impact it will on in terms of geological and also environmental destruction? Thank you.
I think that's a very particular question. Does anybody here want to take it up? Or okay, this gentleman here in front.
Hello, I want to ask the one, I don't remember your name. See, I understand
Pranay.
Decarbonization, we are doing the tree plantation and other thing using less plastics. I'm not buying my clothes. I'm buying only after 3 years. Okay, we have to do such things so that it can be helpful for decarbonization. I want to ask you, this is new to me, the decarbonization of the ocean. How a general public and audience can help to decarbonize the ocean.
So we're not talking about decarbonization of the ocean. In fact, we're saying burial of carbon. In fact, I would like to take the question of the previous gentleman also because it's linked.
Yes.
Now, rivers carry sediments. And like I said, Ganga, okay, you guys have to buy my book. Ganga ka pani kharab kyun nahi hota hai? Have you asked this question? Why does Ganga's water not get spoiled? Okay? It's got something called silicates. It's the only river that transports silicates with active ligands, which I think the doctor would here know what it is. It, therefore, when you store it in a bottle, it doesn't get spoiled. When it goes down with organic matter, it binds the carbon with it and it takes it down the Bengal Delta, gets buried in deep ocean, right? And that's the reason why the Bay of Bengal is an anoxic basin. Wahan pe oxygen ki kami hai. There's lack of oxygen, okay? That's because the carbon there will capture all other carbon ligands, the carbon dioxide ligands, and get buried. Carbon burial is the critical thing. It's not carbon capture. We are getting coal, petrol from deep earth, right? And we are taking it out within weeks, burning it within minutes, and it gets back into the air within seconds, right? How do you get that back into deep earth? If you leave it on the surface, Californian fires will take it off like this. The Canadian wildfires that happened 2 years ago was the same amount of, released the same amount of carbon dioxide that India burns in an entire year. Just one fire. Think about the peat fires that are happening in Russia, the fires in Indonesia, the Tendu Patta forest that burns every year in India. Okay, India burns its forests. Okay, we now need to have a very clear landscape level understanding of how carbon capture happens in our soils, in our ponds, in our lakes, in our streams, in our oceans, in our soils. Okay? So it is not कि मैंने कपड़े नहीं खरीदे, I don't buy my clothes. Of course, that's a great thing. But consumption has to reduce across the board. It has to be through taxes, it has to be through economic disincentives and punitive measures. That's the first thing. The second thing, you need to have a national roadmap on how carbon capture will happen in the Thar Desert, in the Rann of Kutch, in Western Ghats, understanding local realities. Just now we are getting stereotypes from the West, plant trees, do this, X, Y, Z, and it will work. No, it's not going to work. We've passed that moment.
Thank you. At this point, we are out of time, but I would just like to say, please buy Pranay Lal's books, which are available in the bookstore, and James Bradley's book, which is also available. I don't know if your book is available, Jay.
I brought 4 copies.
Okay,
So,
So rush.
let's see some hands.
okay, sorry, Jay, your book's not available. I've just been told.
There are 4 copies, which he has for sale.
If you're
There's a
very good
gentleman
to
there who
him.
wants to buy it.
If you're very good to him, he'll give you a copy. But please do get the books, and thank you for being such a wonderful, engaged audience. And thank you all. Thank you.
Thank you.
Thank you.